Joshua Levy will now be joining us to discuss enhancing efficiency and quality of care with e-signatures. Josh is the CEO of CompuTime, the trusted source for electronic signature capture products. Since joining CompuTime in 2004, Josh has leveraged CompuTime's expert understanding of industry processes and regulations to meet the signature capture needs of the healthcare market that spans from customer education and training programs to the publication of eSignature Lifeline, a monthly newsletter specifically for the healthcare facility. Josh's progressive initiatives have helped hospitals, clinics, and other organizations around the world improve privacy, efficiency, and quality of care through e-signatures. Josh, welcome to the session.
Thank you very much. Thank you for the kind words. And joining me today is Chrissy Taylor, one of our business development specialists, who's actually got more, I say, feet on the street and the ability to give this presentation probably blindfolded. So I'm going to let her run with most of the presentation, and I'll be here for the Q&A as well as throughout interjecting some points. Wanted to first and foremost thank Formfast for inviting us and putting on, from what I've heard the last few hours, a wonderful presentation. And the attendance looks great, and we're looking forward to the presentation. So, without further ado, I'm going to turn it over to Chrissy for the beginning, and I will stay here throughout the presentation.
Hi, I want to thank everyone for joining us today, and thank you for your time. We're going to cover many things today, and we're going to try to do this as quick as possible. We're going to talk about your EMR, your EHR, why you're making the investment. We're going to do an introduction to e-signatures. Topaz is the leader and the preferred provider when it comes to the capture and binding of an electronic handwritten signature. In addition, long before anybody ever came out with any legislation, our HIPAA, Topaz was ahead of the game. Topaz just didn't start this when this became the cool, hot technology. Topaz started this back in 1990 with a vision. And then we're going to discuss why would you use e-signatures and why is Topaz the leader. So when you start looking at why do you invest in an EMR or an EHR, at the end of the day, I don't care if you are a for-profit or a non-for-profit, but you are a business. And just like any other business in any other vertical, you have to run much more efficiently. You have to do more with less. And healthcare organizations probably have issues that other companies don't run into. If you are the owner of the responsibility of an emergency room, you cannot turn away someone. You must take them and treat them. This is not the case in every vertical. Other verticals have the option to turn clients away. So when you start looking at, am I going to bring in an EMR, EHR, and you start looking at what it's going to save you, you look at it from end to end. What's it going to do from time, efficiency, online claims processing, faster money in the bank by doing electronic claims processing. A number of people look at their EMR or EHR and they believe they're going paperless. For the most part, this is true. Most EMR, EHRs have internal signing capabilities for your staff. At the end of the day, it's not the staff that you have to worry about in a malpractice suit. It's the patient. So you're still printing a ton of paper in some cases to capture the signature of the patient. At the end of the day, it's the patient who has to understand the procedures and what's about to take place. When you look at bringing in a patient, there are a number of forms that must be signed up front. Before you ever see me, we have to sign the HIPAA form. We have to sign the consent form, the consent to bill, consent to treat. What if you could take that paper process and move it into a digital age? When you start looking at what you're doing when you move into the digital age, you're already making some investments in hardware, software, server upgrades, training for your staff. When you look at the paper side, what you're going to supply to your patients and have your patient sign, you're looking at the cost of printing supplies. We talked about storage earlier. And one option that most people don't think about is the destruction. What is the cost to destroy those documents at the end of their life? In addition, let's look at the vulnerabilities that paper creates. There's patient identity theft. When you look inside a patient's folder, there's a great deal of information that someone could take away and steal that identity. Disaster recovery. What is the continuity of your paper? What is your backup plan if there's a problem with the paper? Most people are backing up their servers these days. And not only that, but sometimes what will happen, and it's not malicious, but it's been a busy day. Your practice that's a pediatric practice. When one gets the virus, they all get the virus. And all of a sudden you have a ton of paper because you've added these patients into your schedule all day long. What happens if a paper is misfiled? So let's look at what is the real cost of paper. Cooper's Library did this study a couple of years ago. It's all there on the screen. There's not a whole lot more you can say. It is what it is. When you start looking at it, in addition to the paper, you've got to look at the storage. Okay, what does real estate cost you? What does a file cabinet cost you to maintain? What could you be doing with that square footage if you weren't using it for file cabinets? They're saying that cost to retrieve a piece of paper is about $28 in labor on an average. And that's if you can find it. That's if the person who filed it actually filed it the same way that you would. So what Topaz does is Topaz gives you the ability to capture a handwritten signature from your patient, very natural, we all know how to do it, and close the loop. It allows you to actually go paperless. Couple things to think about. How much time is your staff spending at the end of the day filing those printed forms? What if they could capture that signature on a digital original and index it back into the patient record right away? Not even throw it in a pile and hope to have the opportunity to do it later. Think about all the forms that your patients are signing today. So what is an electronic signature? According to the federal government, an electronic signature is a sound, symbol, or process that's logically associated with a document. You have to associate it with the document in such a way that if the document is altered, the signature is invalidated and or removed. So what does a signature do? It asserts identity. When you put something in front of me and we agree and I sign, I'm asserting that I really am Chrissy Taylor. Not only that, but by signing, we're entering into this agreement, and I'm saying that I agree with everything on this paper, as well as you. It prevents denial. So if I came back and said, you never told me that's a potential outcome of chemo, you pull out that informed consent, you go, Ms. Taylor, see your signature right here? And last, it helps to mitigate risk. There are a number of risks involved in the medical industry at this time. There are a number of experimental drugs. There are a number of treatments. It's still an art and a science, but it's not 100% all the time. As a heads up, to the best of our knowledge, Topaz is the only company which provides techniques, tools, and training for forensic document examiners to authenticate electronic signatures in a court of law. So this is what you need as the backup, as the supporting factor when you go to deploy this technology for your compliance and legal departments. So what is a legal signature? It has to be unique to the signer, has to be capable of verification, has to be under the sole control of the signer, and has to be linked to the document. These are all things that Topaz did back in 1990. It's very much so truly mimicking that wet pen to paper event. Oops, sorry. So, kind of what we had discussed before. What are e-signatures legal? Absolutely yes. As long as you meet the UEDA and the e-sign rules that we discussed, and you meet the qualifications, it is a legal signature. So when you start looking at electronic signatures, we talked about this a little bit in the beginning when we covered the business aspects. An electronic signature is a handwritten signature that can be bound into the document and proved or verified in a court of law. A digital signature tends to be either a public or a private key infrastructure, password login scheme, and these are great signatures when you start looking at your internal staff, but it would become a nightmare for your IT staff to administrate that for every one of your patients out there. When you start looking at the cost factor, an electronic signature is much more cost-effective to support for your patient-facing events than a digital signature. Everybody throws HIPAA out there. There's a lot more to HIPAA than what most people really sit back and look at. You cannot pass out a patient's information without their consent. There are a number of organizations that look at documentation that we don't even think about. We always think about the healthcare provider or the point of service. There are a number of back-end folks who are also affected by HIPAA. When you start looking at your health plan, filing claims, clearinghouses, these folks all also fall underneath the HIPAA compliance. So again, you as a practice or a hospital system are faced with all this potential paper now because you have to have their consent. When you start looking at the intake of a patient, I come in to see you. I have to sign a HIPAA form. It's not going to affect how well I'm treated, but if you're audited, you have to have it on file. Second, I have to sign a consent to bill my insurance company. Guess what? That's why I pay insurance. I'm happy to sign that. I also have to sign a consent for treatment. If I didn't want to be treated, I wouldn't be there. And these are just 3 of the big forms that must be signed. How many patients are signing these that you're keeping up with these pieces of paper throughout your system? By taking those forms into an electronic format or a digital original, you have the capability to capture the patient's signature, which again is very natural and you're not teaching them how to use a new technology. On these forms, you can always offer them a printed copy. On their printed copy, their signature will be displayed, but you on the back end have the opportunity to file or index that back into the electronic patient record. When you start looking at this, in addition to all that, you're going to decrease some of the wear and tear on your hardware. You're never going to quit printing. We all talked about this years ago with email, how we were going to go to this paperless world. You're not going to quit printing, but stop and think how much of that work you can take off that printer and how you can elongate the life of that asset just by moving to a simple procedure. So why would you use e-signatures? The benefits are, again, I don't believe you'll ever eliminate paper, but you can definitely reduce the amount of paper used. It reduces the physical storage requirements. There are a number of hospital systems that I've talked to nationwide that actually have buildings that are better than 10,000 square foot with full-time staff where they are maintaining paper records even though they're scanning, because they still have to have that paper record with that wet signature in the event that a patient does repudiate. Direct labor savings. Even if you're doing a data warehouse and you're nearline or offline, your recall time is going to be much quicker than sending someone out to a warehouse to look for a specific signed document. You're going to shorten your process time. Wouldn't we all like to go home at 5? I would rather go home at 5 than stay to file documents. If I can index that in immediately to that patient file, you better believe I'm on board. It's a more reliable signature. One of the things that we haven't talked about, and I want to dive into here real quick, is Topaz has truly mimicked that wet pen to paper event. So in the event of repudiation, a handwriting expert looks at the pen strokes of the person in question. What Topaz has done is using software and a hardware combination at 377 points per second. It's capturing those characteristics that that handwriting expert looks for. It's compiling this information and binding it into the document. Now, when you look at your digital original, you're going to see a great representation, because we're doing it 377 points per second, of your signature, But in addition, there's going to be all this information behind the scenes. In the event that somebody repudiates those verification tools that we talked about, Topaz will release those to forensic experts once they've verified their credentials and even train them on how to extract that data and use that data against other signatures and other handwriting samples to determine whether or not that individual was a signer. When you start talking about crossing vectors and being able to compute things and time them, it is a much better signature than a wet pen. On a wet pen, there is some guesstimation that does occur. In addition, it allows for straight-through processing. When you start looking at claims going out to insurance companies and Medicaid companies, it's just a much quicker process than mailing paperwork. If you've ever filed a Medicare claim and you've missed a box that you should have checked, you understand that what was going to be 30 days, which is really 60, is now 120 until you have those funds in the bank. And it reduces negative impact of post-purchase behavior. We don't like to think in the medical community that there is post-purchase behavior, but there is. When we start talking about treatments for diseases, you and I sit down and we discuss what the treatment is. I'm on board with it. I go home, I talk to my husband, who thinks he's a doctor. There's a little difference. Once I've signed that and I've made that mental commitment in my head to this process, it is going to eliminate some of that later regret. So when you start looking at digital image versus handwritten holographic, Topaz is really the leader. There are a number of solutions out there in the field. Formfast has always been a big supporter of our ClipGem. The ClipGem is for our print and sign applications, somewhere where you want the patient to walk off with instruction sets. Think about places like your emergency room department, pre- and post-op, places where we're going to have that conversation and maybe I'm not going to be 100% focused because of the news that I just received. You're going to print off that form. You're going to put it on the ClipGem. As we go through it together and I mark up, you're going to see my pen strokes real time on the computer screen. When I'm done, you hand me that paper. I go home, I hang it on my icebox, and I have it to refer to later. In addition to that, we have sign and print. Sign and print are the pads, which most people are a little bit more accustomed with. I sign on a pad. If I want a copy, then you print me out a copy and I take it home with me. So it used to be we did everything in wet signature. When you look at a wet signature versus an electronic signature, a wet signature is a traditional pen to paper. We're going to print it off, bring it to you, you're going to sign it. I'm going to go back to the scanner, I'm going to scan it in, then I'm going to file a hard copy. And this becomes very, very inefficient. The other thing to consider is we talked briefly about this earlier. What is the continuity of your paper? When you start looking at your DR plans, which I'm sure everyone has, you review that once a year, what do you do if a water pipe breaks? What do you do if you have a fire in your location? Those are things that are natural disasters from coast to coast and no one can control, and they do happen. What do you do then? Do you just hope for the best? If you're doing an electronic signature, that's going back to your server, and your server's being backed up. You have more protection. So today, you can eliminate a couple of those steps. I can pull that digital original up on the screen, review it with the patient, have the patient sign, index that back into the patient file, and then back my server up on a regular basis. We're just going to take a quick example here, and I would not hold this to be the gospel, but this is a really good representation. When you start looking at the cost of a wet paper HIPAA form versus a digital original, look at your cost of paper, your cost of printing, your cost of scanning, your cost of indexing, storage, and shredding. So on average, you're looking at about 34 cents a page versus 3 cents a page. What if you have a total of 5 doctors working in that office? and you're seeing a total of 5,000 patients on an annual basis. And you have 5 forms that they sign, that each new patient must sign. You're looking at a total of 25,000 forms. If you're doing this on paper, you're looking at an average cost of 34 cents for a total cost of $8,500. If you were to move that to an electronic format, you're looking at a cost of about 3 cents a form. So your total cost is $750. Even if you were to double that number, if that number is too conservative for you, double that number to $1,500. So on 5 doctors, you just saved $7,000 annually. Now, $7,000 may not sound like a lot when you start looking at, purchasing equipment like MRI machines, but I don't know anybody who would turn down a check for $7,000 right now. There's a number of places those dollars can be reallocated. So at the end of the day, when you start looking at an EMR or EHR, you're really looking at enhancing patient care. You're looking at giving your doctors better availability to medical records. You're offering your patients better services. You're doing data mobility, which is becoming huge now on the iPhones. You're allowing more time to be spent with the patient and understanding what the patient's true needs and lifestyles are. And you're also going to start reducing medical errors, and you're going to save on administrative time. I want to step outside the EMR for 2 seconds. We've talked about it quite a bit today, and there are a number of other places within your hospital system that you could look at moving to an electronic signature to help reduce paper. Think about your HR department. If you can move all those forms electronic, why wouldn't you? Again, we're talking about a great opportunity to steal another employee's identity. Your entire life is in your HR file. What if you could move the I-9s and the W-9s and all that to a paperless format, have your employee sign, and index that back to a secured location on the server? What about administrative and finance? Think about all those CapEx expenditures you get hit with at the beginning of the year. Think about all the folks who are out there getting quotes for those CapExes, and there's that workflow process. Quality control. In a hospital environment, I'm sure somebody's got to go through and inspect all the IV drips and every other piece of equipment to make sure that it is up to snuff. What if you could take that to a paperless format? And supply chain. One of the great things we didn't talk about, Topaz by default does a time, date, and stamp for the signature. What a great way to stay on top where the bottleneck is. And then obviously patient services. To give you a little background, as mentioned, Topaz has been around since 1990. They were actually founded based off pen-based technology for the Slate PC. They're privately held. Currently, I want to say last year it was better than 33 million. The slide's a little old. And Topaz owns the market share worldwide. We're currently delivering to about 103 countries, I believe was my last count.
Thanks, Tracy. So, and just to give some more background, what happens with Topaz is we're not the devices that you see in the point-of-sale. Yes, Topaz is in the point-of-sale world, but those we call receipt-centric, and Topaz stays more in the document-centric. And so I think the last time we did something with Formfast, there's a statistic. There's over 1,000 forms in the medical world, and only 20 to 30, maybe 50 tops, require signatures. And so what we find with Topaz, and I'm just going to go through some more of these sites. What we find with Topaz is that we're often either that back end missing piece to the full paperless process. And so some of us call us like a peripheral or a bring-along technology, and other people would call us something that enables the paperless process. And as our relationship, CompuTime is the fulfillment partner for Topaz and providing the signature pads through a distribution channel such as Formfast and other partners as well. So without any more kind of details about the Topaz, I'd love to turn it over to questions and answers, and we can kind of free flow some things that you may have about electronic signatures and go into more detail based on your requests.
Okay, great. Thank you very much to Chrissy and Josh. We really appreciate it. We had one question come up. How do you connect the pad to the Formfast products?
So I would flip that question to the Formfast family, because they would know much better than we would, because we're probably just providing that hardware to them, and the integration is more on the Formfast side. So can I turn that over to someone on your end?
Well.
Or can we send them an answer?
Yeah, definitely. We'll get back and send you an answer on that one.
I'd like to jump in real quick. Formfast does a fabulous job, and each forms development that they do for each organization differs slightly from the last one. Formfast does a great job of listening to their clients and understanding what their clients are looking for and needing. Depending on your environment, there are a couple solutions that Formfast has rolled out. So that you are aware, Topaz currently has a little over 58 products in active production. There's a couple of them that Formfast likes, and one of them is that ClipGem. It's really big on the McKesson side, and I can't tell you why. I guess it's a patient preference or the organization preference. The other one that they like quite a bit is the Signature Gem backlit LCD 1x5. Now, both of these units are available in a USB connector for communication in a fat client environment. If you are on a thin client environment and you're running Citrix or terminal services, and I know we've done deployments like this, for the ClipGem, you have to go with a serial connected device. There are converter cables, I understand. Serial ports are going away. They're a thing of the past. If you don't have an open serial port, you need to look at a converter cable. When you start looking at the Signature Gem backlit LCD 1x5, that unit now comes in what's called a BSB model. That model was designed specifically for the Citrix or thin client environment. It allows you to connect and pull power via USB port, but has a chipset internal to the pad that does the COM conversion or the COM port redirect. Does that help?
Yes, absolutely. We're going to see if we can get one of our tech specialists to get on the phone here and see if they can answer that question from earlier. Ken, are you available to talk? Or Brad? No. Okay. Well, we'll move on.
Okay,
and
I'm here.
Who's on the phone?
This is Ken. Yeah, sorry
Ken.
about that. My phone was mute and not mute, and it was also handset muted. So I apologize for that. I've got maybe some bandwidth issues or something. So
the question was, how do you connect the eSig pad to Formfast products?
Well, we do that through the Form Imprint, and also now in a future version of Web Form Imprint, you would go ahead and register the patient and process them through the normal HCIS-based registration. The form would print out, and you would put it on the signature pad, and they would sign it within Form Imprint, and the signature would be captured there on the Form Imprint screen so that the patient could see it, the clerk could see it, and then it's either printed out or it's archived or both.
Great. Ken, thank you very much. I appreciate it.